Welcome back to this presentation being handled by Mrs. Prudence Amito. We shall be looking at patient's needs assessment. As we know, providing whatever that the patients require is part of our training. So patients needs a lot aside on medications that we give them. So whatever that we need to be available for them to pick up from their health and from their health would be assessed under patient need assessment. So we shall be looking at basically what is required of us, especially when you look at patient's needs assessment. We are looking at those other basic needs which are supposed to be availed, or what we call fundamental needs of the patients. So let's look at what is patient's assessment needs. So patient's assessment need is a process that identifies specific needs of individual patient in order to tailor healthcare services and interventions to their unique circumstance. So as you see from the definition, we are not going to look at all patients in general. So when we are looking at patient's need, we want to look at each person, each individual, what do they require, or what is it exactly that they need, so that the quality is given to them, or so that they come out quickly. So this process involves considering patient's perspective. We are looking at the clinical needs, we are looking at ethical consideration, and the resources which are available. So what are those importance of assessing fundamental needs or patient's needs or basic needs? So assessing the fundamental needs of the patient is essential in providing holistic and patient-centered care. So when we are to talk about patient's need assessment, we are looking at what is called patient-centered care. Whatever we want to do on the patient should make sure that, or should be something that the patient needs or requires. So by understanding and addressing the fundamental needs of the patient, healthcare providers can promote well-being, optimize health outcomes, and improve the overall patient experience. So assessing fundamental needs helps identify any existing problems or potential risk that may require interventions or support. So this is one of the importance of assessing patients' needs or fundamental needs. So let's look at those needs that the patients would be expecting from us, one of which is physical needs assessment. So physical needs assessment involves evaluating the patient's physiological health and determining if immediate interventions or treatments are necessary. So when we talk about physiological health, we are looking at the functional part of the body. So it includes vital signs, it includes pain levels. We want to assess pain levels, we want to assess mobility, we want to assess nutrition, hydration, activities of daily living. So that is what we talk of when you see physical needs, something we can assess externally. So addressing physical needs ensures the patient is comfortable and safe, and overall physical well-being. So that is one of the needs that you need to assess when you are assessing patients' physical needs. Patients' needs. So the next is emotional and psychological needs assessment. So when you look at emotional and psychological needs assessment, it focuses on understanding the emotional status and the mental well-being of the patients. of or of the clients that we are having. So their emotions can impact greatly on their health or even on the health of the unborn child. In most cases, let's say if we look at rape cases, or we look at defilement cases, or any other cases, especially in early pregnancy, you find that we usually talk about less stress. So we find that stress is one of the contributing factors of uh, or early or miscarriages, especially in early pregnancy. So we want to make sure that we assess the emotional and psychological status of our patients or of our mothers or of our pregnant women so that we avoid uh, miscarriages. It includes evaluating the patient's emotional distress, stress level, coping mechanisms, support systems, and any sign of anxiety, depression, or mental health concern. So, just like I've said, if you have found that maybe somebody is having issues, let's say it was a rape case, and they're having difficulty in coping with the pregnancy, you can talk to them about other coping mechanisms or what best they can do so that they can carry pregnancy without stress. Next is addressing emotional and psychological needs, promotes mental well-being, reduces stress, and enhances patients' ability to cope with a healthy healthcare journey. So even if not only in pregnancy, you find that it's really very important to always handle emotional and psychological needs of whatever client or patient you're handling. Our next assessment would be a social and cultural needs assessment. So social and cultural needs assessment involves recognizing the patient's social context and support network and cultural background. When you look at social needs assessment, we are looking at the people who are supposed to provide support in times of their needs. So you need to know the family dynamics at that time. Uh, how do they communicate with the family? Are they able to support anytime the person needs support? What about the friends if family members are not there? So that is social part. Living situation, it includes understanding the patient's dynamics, living situation, social supports, and cultural beliefs. So when we talk about cultural beliefs, we want to see those cultural sensitive cares that we are supposed to provide with respect, while respecting the woman's values and preferences. So as we are dealing with social and cultural needs, you should also be culture sensitive. So the next need is spiritual needs assessment. Very important. Spiritual needs assessment focuses on understanding the patient's spiritual beliefs, values, and practices. We usually ask this when we are taking biodata or social demographic information. It's not that because we want to take, we want to know who the spiritual needs or beliefs of the person or practice. So it is important to know the spiritual needs of the person you're handling, such that uh, at one point, if needs be for you or for the family members to invite, or if at all they're invited, maybe a pastor or a priest or prayer groups to come and help, you will not be offended because you already know the spiritual practice of that person you're handling. So it includes assessing the patient's needs for spiritual supports, connections, meanings, and purpose. So sometimes even you as you, because much as we are health workers, we cannot do everything. Others are interventions from the Lord. So you can always support. Even you yourself can support your clients or your patients. If they allow you, you can pray for them. Addressing spiritual needs promotes holistic care, provide comfort and solace, respect and patience spiritual journey. So we should always embrace the spiritual journey or spiritual practice of the people we are handling. So our next is identifying problems and risk. As we are trying to assess patients' needs, we should be able to identify problems and their risk. So during assessment, healthcare providers must identify any existing problem or potential risks that might affect the patient's health and well-being. So as we are doing the spiritual, we are doing the emotional, we are doing the whatever needs assessment that we are doing, it's important that we should be identifying anything that might put the patient's health at jeopardize. So this includes identifying acute and chronic health conditions. There are some acute and chronic health conditions, identifying signs of deteriorating, assessing for complications, and recognizing risk factors. So sometimes as you're doing the needs assessment, you might find that you are able to identify what you are not able to identify during clinical examinations. Then identifying problems and risk enable timely interventions and appropriate referrals to develop and the development of individual care plan. So as you're doing needs assessment, you are able also to identify any problem, and if there is one, you can always develop each individual plan for each of those patients. The next thing that will help us to do patients' needs assessment is collaborative care planning. So these needs that the patients want might be too much and you cannot handle it alone. So you need to collaborate with other teams. Assessing patients' fundamental needs and problems serves as foundation for collaborative care planning. It involves working with the patient, their families, multidisciplinary healthcare teams to develop a comprehensive care plan that addresses the identified needs and problems. So as you have been seeing, or we have been looking at collaborative care all this time, it is very, very fundamental, very important in midwifery that you involve the patient, their family, and also people who might be needed or some healthcare teams that might be required to make sure that you provide quality care to the patient. So this collaborative care is still patient-centered. So if the patient does not want you to involve other teams, you should allow them to make decisions. So collaborative care planning ensure coordination and patient-centered care, promote shared decision and support achieving optimal health outcomes. So as you're doing collaborative care, there is coordination, meaning from the other side, where whatever findings that was got will all be put to table and people discuss, and thereafter patient is involved, and you promote shared decision. That means you're not going to decide on the next plan of care alone. So in summary, as you're doing patient needs assessment, you should make sure that the patient is at the center, because what we are assessing, we want to know what the patient might need during their time of hospitalization or during their time in the hospital. So whatever care that you would want to provide, make sure you share with the patient and allow them to decide on what they want to do. Thank you so much for listening. We shall stop here for today.